The newer technology allows to be able to, within one glance, within one view, be able to see everything inside your eye. And that's kind of where eye care is going. You know, one of the things that I always try to do is every time I stand up, do my commercial and so forth, kind of give you a little bit of information. That way, you know, wherever it is that you get your eye care from, at least when you go in, you can ask the right questions. You can ask them, you know, different things that at least show them that you know a little bit about your eyes, and a challenge to them to provide a better care for each of you. I'm also on faculty at 3 different schools now. So the students that you saw last time, Chris, he's from Arizona. I'm also on faculty at the one in Pomona and my alma mater at SUCO. So we have students in the office all the time. The reason why I have them in the office is it challenges me to keep updated with what's going on, and it kind of meets with the mission statement I have. You know, we're constantly trying to improve our clinic and improve the ability to care for our patients better. So that's kind of where eye care is going. At this point, what I kind of challenge you to think about is wherever it is that you go for eye care, ask them the right questions. Ask them what they have, what they're doing, how are they able to assess, you know, the health of your eyes. And so, you know, make sure that at least they're updated to what they're supposed to be. All doctors, and I think lawyers and attorneys, you know, and CPAs, we all have to do continuing education. We all have to keep updated with what's going on in the industry and in the profession. So make sure that the folks that you get, you know, your care from are at least updated in that manner. Questions? Yes.
How often do you need an eye exam if you have glasses?
Glasses doesn't dictate how often you have an eye exam. Eye exams are actually recommended every single year. Kind of like the question I ask my patient is, with your car, you want to wait until the car died, then you get the oil change, you want to do it on a regular basis. Same thing, eye exams are dictated to be done every single year. That's one of the reasons why the insurance company, they have to pay for the eye exam every year. And new health policies are coming out with Obamacare and so forth. One of the changes that will be coming out is that anyone under 18 are required to have vision plan, and they're required to have an eye exam every single year as part of the health exchange. Any other questions? Yes, ma'am.
I was just in his office this last week, or 2 weeks ago, I guess, and for my yearly eye exam, and of course I needed new glasses, and he had the students there, like you said, and those students told me that the reason why I needed new glasses was because of my age. So that's why they're there, because they have to learn how to be a little nicer. I sent them packing, out of the room. He does a wonderful office with those students.
Yeah, we'll send them back. I know. Anyway, students lack certain communication skill. I'll put it that way. Any other questions? Yes, ma'am.
What are your thoughts on gas permeable contact lenses, the harder ones?
The gas permeable contact lens was called rigid gas permeable. They were one of the first contact lenses that were out there. And so the amount of oxygen that goes in and out is minimal. The way it works is because it actually doesn't hug to the eye, there's a tear exchange in between, and that's how oxygen gets through in and out. They're actually fine as long as you can deal with the discomfort. Yeah. They're one of the first contact lenses that came out. Currently, there are soft lenses, so those are a little bit better. Just make sure that if you do soft lenses, they're the material called silicone hydrogel, and that allows more oxygen in and out. Any other questions? Thank you. And thank you for